Hi, my name is Shirley Washington, and today I'm going to be doing my blood administration video. I am in 366 section 2. Um, I went through a practice of mine, so I have opened some of my stuff. So I do have a fresh bag of saline here, but my tubing is a little wet, and you can see a little bit of the blood, but I'll make sure I verbalize well. So that it can be seen and you guys know what I'm doing. I also have my pretend IV hanger up there. So the first thing I'm going to do is I'm going to make sure that I have all my stuff gathered. I'm going to go to the blood bank, get the blood. I've got my bag upside down here because I punctured it and I don't want it to spill. So I'm gonna check before I grab the blood, I'm gonna check the order. I'm gonna have 2 patient identifiers. I'm gonna make sure all the forms are signed, consent, requisition form, any of those forms are signed and ready. Then I'm gonna verify with another nurse before I administer, and I'm gonna make sure the bag is labeled as it should be, patient name, any identification numbers, any type of the blood type. I'm going to make sure the blood type matches the patient blood type and the RH factor matches. Have a second nurse double check all that to make sure that I didn't miss anything and that I'm giving the right product to the right patient. So after I've done that, I'm going to go ahead and perform hand hygiene. So I would perform my hand hygiene and I would apply clean gloves. Okay, so after I've got all my stuff ready, I do have a filter on my tubing, so I don't need to apply that. I can go ahead and make sure all my clamps are closed, which they are all in the closed and off position here. And then I can go ahead and spike my sodium chloride bag. Whoops, maybe. So I get that spiked and hung. You want to hang it about 39 inches, I believe, above the puncture, where your IV catheter is. So I could then go ahead and open that tube and have fill the tube. And I apologize, my tube it just has a little bit of the blood product left, but I did try to clean it out the best I could. So you're going to want to fill this until it gets above the filter with the saline. So I'm above the filter there. Tap and clear any air bubbles that might be present. Open the clamps and prime the tube. So my tubing is primed, it's spraying out there. So I go ahead and clamp that back. And I would attach this to the patient's IV catheter, attach it to the patient's IV catheter, and I could be running the normal saline. After that part, I would go ahead and get ready to hang my blood. So typically you would gently mix the bag. I'm not going to do that because I already spiked it and I don't want it to spill everywhere, but you would gently take the bag back and forth to make sure that everything is mixed, and you want to do that gently so you don't destroy anything in the product. So then I could just double checking that I'm closed there, and I'm gonna go ahead and spike my bag and hang it. I can open the clamp here and make sure that it flows into the tubing. I'm gonna clamp my saline, and I've got blood flow into the tubing here. And I would then get that set up to run. As you can see here, it is running through the tube. This would be connected to the patient's IV catheter, not my sink, but so that would be running there. After, I would remove my gloves and perform hand hygiene. And then you want to make sure to observe the patient very, very closely, especially during the first 15 minutes, to make sure there's no adverse effects and the patient is tolerating the transfusion as they should be. So that's it. Thank you.